Good evening, Madam Chairwoman and fellow senators. My name is Dr. Sheila Kerry Kuzmic. I'm a pediatrician from Westerly, Rhode Island. My credentials go a little bit further. I'm a mom. I'm also a mother of a daughter that had an adverse diagnosis in utero, of which, for me, I chose abortion was not an option. And one other area that I want you to know about is I've spent the last 20 years of my clinical practice counseling post-abortive men and women, which really is an area that I think we all need to start looking at, especially when we are enacting laws to this extreme, where we're pushing bills to abort babies, especially in late term. We're talking about mental conditions of the mothers prior to. Let me tell you something. Did we ever think about the mental situation of a woman after, especially after a late-term abortion, but any abortion? It exists. It's inhuman, it's barbaric, but I came here tonight because we're not really talking about the other patient. There's two patients. As a doctor, I'm a pediatrician, we take care of the babies. And I think sometimes in this discussion about abortion and abortion bills, we forget. We keep calling it products of conception. We call it fetuses. It's a baby, for gosh sakes. It's a baby. It's a baby at 8 weeks. It's a baby at 16 weeks. It's a baby at 32 weeks. It's a baby at full term. So we have to be very careful what this bill implies and what's going on with the other patient, the infant. Why do we have fetal maternal medicine? There's two human beings. Let's look at this. I brought you some, these are infant models that we use when we're counseling women, at least that I do, when I'm counseling women in post-abortion decisions, what they've gone through. I want you to look at, we're talking a 16-week baby. You look at this is a human being. I mean, it's smaller than you and I, but on a human scale, we are talking a human being. We're talking now a 22, 24 week. This whole discussion of viability in medical school 22 years ago, I was taught that viability is 22 weeks gestation age. 22 years ago at Georgetown University, our NICUs were filled with babies that we were providing care for at 24 weeks, 25 weeks, as early as 22, although rare, but babies are surviving. And now 20 some years later, we have incredible medicine, fetal medicine. The other thing I want to talk about tonight is the procedures that we're talking about. Ladies and gentlemen, we're talking about murder. We're talking about killing. The only way to get rid of the baby in the womb is to brutally dismember the infant, depending on what procedure we're talking about. Let's get real. Late term, the babies are bigger. It's a lot more difficult to kill this child in the womb. What does it entail? It entails invading its sterile home, its womb. It invades, turning this baby. We know that this baby cannot be born head first, because if it's born first with its head, then it's alive. So we have to go into the womb, manipulate, turn the baby around, deliver the feet, deliver the baby into the birth canal up until its neck. And then what do? We stab it. We stab the baby. We stab it in its neck to kill it, and then crush the skull, and then deliver the remaining parts. If it's a little less complicated, we dismember. What does that mean? We pull its arms, we pull its legs with grotesque manipulation of tools that do nothing other than ensure this baby's death. Yes, I put my head down too. You think I like talking about this? I've spent my life taking care of babies. What are we doing? Wake up, America. Wake up, Rhode Island. The blood of these babies is on your hands. Do we have any compassion for the child in the womb? We talk about patience. Does this child have any rights Does this child feel pain? Yes. Come on. Anybody that's held a newborn baby or close to birth knows that baby feels pain. I'm sorry that I'm being so brutally visual, but we need to look at this for what it is. It's inhuman, it's barbaric, it's insanity. And is this what we're going to succumb to as human beings? And as doctors, I'm ashamed. I'm ashamed that my profession would lower its standards because, yes, it kills babies, but it hurts women. Please, I beg you, do not pass this law. Thank you.